Thank you, Peter. So my name, as Peter said, is Delia Grace. I'm an epidemiologist and a veterinarian. I work at the International Livestock Research Institute in Nairobi, where I lead a program on food safety and zoonosis. And I'm also manage a food safety work within the CGIR research program on agriculture for nutrition and health, led by IFPRI. So in this presentation, I'm just going to take us quickly through some of the issues around food safety, why it matters so much, why we should care. I'm going to talk about, first of all, about the different markets for food safety and how in the past the markets which have been most looked at and there's been most concern about are probably the least important for poor people. I'm going to discuss a little bit about how big a problem it is and what we see as the critical issues in food safety. And those are especially the high-value perishables, meat, milk, fish, fresh fruits and vegetables, but also the aflatoxins, these fungal toxins which infest most staples in the tropics, and the diseases increasingly associated with water and water scarcity. And though we're talking about an emerging crisis and a problem, I want to end on a positive note by showing that something actually can be done about food safety in these most difficult to reach markets, the markets where the poor buy and sell. So taking the case of Africa, seeing as we're here in Africa, food safety is one of the biggest health problems. In most of the African countries, we find that among the top 5 causes of sickness and death is gastrointestinal illness. This is the finding of the World Health Organization. And somewhere between 30 and 70% of this gastrointestinal illness, which is among the top causes of sickness and death, is associated with food, contaminated food and water. But while it's a challenge, it's also an opportunity, because the African continent represents a huge market for these highly nutritious but highly risky foods, and it's a growing market. Now there are around 1 billion consumers. We expect by 2050 2 billion. Now we see that animal source foods contribute just 6% of the diet, whereas in Europe it's more like 20%. We see this as the future, a rapidly increasing demand for the highly valuable, highly nutritious, but highly dangerous animal and fish source foods. So where are people buying these risky but nutritious foods? At the moment, it's clear that more than 80% of meat, milk, fish and eggs is being produced by smallholders. It's being produced by small-scale farmers and sold in what's called wet markets or informal markets. These are the markets which are not supermarkets, where food escapes regular structured inspection. And these markets are often very disliked by regulators. Regulators hope that we're going to move to the big farms, the industrial farms and the supermarkets, where they can easily see what's going on, regulate, inspect and make sure that things are working. The informal markets have no effective health and safety. There's many people, there's poor infrastructure, and they've never really received much support from the government. But on the other hand, they produce food which is cheap and fresh. They often sell local breeds which come from small farms. And people like these informal markets. That's what we find wherever we look. And while in some parts of the world supermarkets really are expanding fast, the best models suggest that in Africa, up till 2050, the majority of food is still going to be sold in informal markets and still be produced by smallholders. So this is where the problem is. It's where the poor buy and consume. It's where we need to work if we want to make a difference to the big burden of disease. And in these markets, in developing countries, people are concerned. People know that food safety is a big issue, and as you get more media and move towards more sources of information, it becomes a bigger and bigger problem. Those of us from Europe and America, we are kind of aware of this. Every few months there's a scare, whether it's that there's too much horse in your hamburger or too much E. coli in your sprouts. And we know that these are shocks, that when you get things like this, when they get into the news, it really makes a difference in what people do. We've been looking in developing countries. There's a myth that poor people don't care about food safety. And there's a myth that developing country governments should focus on food security. Food safety is a part of food security. And in the countries we look, we find that people are concerned. They say they're concerned. We do economic experiments, and they show that they're willing to pay a premium for food they believe is safe. And their action, their behaviour reflects their concern. And we've done studies that show when there is a bird flu scare, a Rift Valley fever scare, people stop buying this good, nutritious food because they're frightened. A case in point is aflatoxins. I mentioned these fungal toxins which are found in staple foods in maize, groundnuts, sorghum and milk, just to give a case study of the things which worry Kenyans. In Kenya in 2004, there was the world's largest outbreak with hundreds of people dead. This was all over the papers. There was panic. But at the same time, there's a silent burden of many of these food safety problems. In Kenya, every hour, 3 Kenyans die from liver cancer caused by their consumption of maize with aflatoxins. CDC conducted a large study which showed practically everyone in Kenya has got aflatoxins in their blood, including us who live and eat in Kenya, and Abigail can talk more about that. And just this year, we sampled milk in Nairobi. Nearly 50% exceeded the levels. This is why people worry when they see this in the newspaper. Some of my colleagues with young children, they have stopped giving cow's milk to their kids. They're giving them soy milk because they just don't want to give them these toxins that cause cancer. And indeed, when we do studies, we've now done studies in many, many markets in different parts of Africa, Asia, and we find that there is, what I say sometimes is if you look for a problem, you'll find it. And in many of these countries, one, there is no effective reporting system for food safety or foodborne disease, so people don't see the magnitude. Another, there are many parasites and problems which we know are sickening and killing people in Europe and America, but they've just never been looked at in the countries we work because they're difficult to find. At ILRI, we found for the first time ever trichinella in pork in Uganda and listeria, which is the listeria hysteria, one of the major foodborne diseases in Europe. It was in Ghana. It's probably been in Ghana forever. No one had looked for it because it's very difficult to culture. We looked for it, we found it. Generally speaking, we've done around 50 or 60 of these studies now, and every study which we do finds that there are high levels of hazards. There's high levels of bacteria, of parasites, of toxins, of antibiotic residues in the food which we eat every day. But should we worry? To what extent is this something which we then need to ban all the food? You can look at those numbers. 80% of fish unacceptable in Egypt, 98% of meat unacceptable in Nigeria. So if we were to follow the regulations, we would just remove that 98% of meat from the market. We believe that this would not be a very feasible or practical thing to do, and also that it would have very negative effects on the nutrition of poor people and also on the small farmers who are selling their products into these markets, and the women, the retailers who are mainly women who are processing them and selling them. So one of our key messages from our studies is, if you like, hazards you always have with you, pathogens you always have with you. And what we really want to understand is what is the health and economic importance of these, to understand how much regulation, how much innovation, how much change we need to get to the ideal where we have safe food, but which is also fair food, which also supports the livelihoods of poor farmers, the nutrition of poor consumers, and the livelihoods of everyone along the value chain, and allows poor people to get on board this amazing opportunity which is being offered by the livestock and fish revolutions in Africa and Asia. And to do this, we need to move the thinking of problems from just pathogens, from the level of aflatoxin or the level of hazard, into the harm it does to human health. And this is where we need to move away from conventional pathogen-based thinking to risk-based thinking. So when we look at risks, we find very different and mixed results. In Vietnam, where Hung comes from, we found that meat was very contaminated, but it wasn't causing illness. The illness was coming from the vegetables, and that was because the meat was cooked very well. In Nigeria, on the other hand, the meat was very contaminated and it was making people very sick. This, more than every fortnight in Nigeria, 10% of people get ill from the food they eat. When we looked at it in India, we found that the meat was very contaminated, But the meat wasn't making people ill, the vegetables wasn't making people ill, it was the kitchen, it was the hygiene in the kitchen. So by taking a risk-based approach, we don't just say 98% of meat contaminated, ban all meat, bury it in landfill. We say, do the studies, find out where the problem is coming from, and tackle where the problem is coming from, which in many cases is not actually the meat. Here's a quick example again from Vietnam, where you have the informal markets, which are the present, where 80%, more than 80% of the poor buy and sell. And on the other hand, you have the supermarkets, which some people think is the future. And a lot of policy is pushing towards supermarkets and commercial farms and industrial farms, often driven by concerns about food safety. When we actually do the studies, graph is a little bit complicated, but just the take-home message is the meat sold in the supermarkets had far more pathogens and contaminants than the meat sold in the wet markets, in the informal markets. And this is how science can bring evidence to help decision makers better understand where the risk is coming from. It's not always obvious. And this slide often creates a great deal of debate. So I'm sure there will be, but there are reasons why in many ways we think smallholder farmers, wet markets can provide just as safe, if not safer foods than the alternatives. Our studies have also shown that food safety is largely highly driven by cultural and other factors. For example, in these butchers in Nigeria, women butchers sold much safer meat. They had the same knowledge, they had less access to resources, but the meat they sold was safer than the meat coming from the male butcher in the kiosk next to them. We find that people who experience a lot of harassment over food safety often produce more dangerous food. And finally, the safe food, fair food. There are many benefits from these milk and meat sold in informal markets. The first being price. This is in Kenya, where if you're a poor woman wanting to give your child highly nutritious milk, you can get a litre for 90 shillings in the informal market, but pay 50 shillings for the pasteurised in a packet. My last slide, and the good news slide, is that although these problems are here, food safety is a huge problem. Our research and others' research has shown that improvements are feasible, effective, affordable, and highly beneficial to economies. In Kenya, by recognising and building the capacity of the raw milk, the informal milk, we found this led to more safe milk and saved the economy 33 million. For those butchers in Nigeria, peer-to-peer training led to 20% better meat and saved nearly $1,000 a year per butcher trained by reducing medical costs. So the end result, the sum up, if you like, food safety is one of the biggest health problems and economic problems facing developing countries, we think the evidence shows. At the same time, producing food is essential to the livelihoods, consuming food is essential to the nutrition for poor people, and when we're trying to do things for food safety, we have to make sure that food is not only safe, but it's also fair and continues to support the livelihoods of those who depend on us. Thank you.
There is a crisis, Delia, right? I mean, it says here, options for addressing a growing crisis. Crisis is what the word you used here. You didn't use it in your presentation.
Well, it was two things. One, I think, is I think we sometimes find it's counterproductive to frighten people too much. You can get people's attention by telling them you're all going to die soon. But when we come to solving the problems, we want to make people maybe think a little bit about the magnitude of the problem, but not that this is an insoluble problem. This is a crisis, but it is a crisis which has got a solution.
Great.